Just to give you some background information about myself, I graduated from Harvard and completed my medical training at Oregon Health and Sciences University in Portland. I'm a native of Portland. Then I did my residency in OBGYN at UCLA and my fellowship in fertility at Johns Hopkins. And I worked at Johns Hopkins for about seven years as a faculty member before I left Hopkins to go back to Oregon, my home city, my home state. And I've been the medical director of Oregon Reproductive Medicine since 1999. Our clinic was founded in 1989 by my former partner. At this point, we're one of the largest fertility clinics in the country. We perform annually about 2,000 IVF cycles. What makes our clinic quite unique is that we have an excellent laboratory that was designed by clean room engineers, the same engineers who designed some of the fabrication plants at Intel. So the environment in our laboratory is extremely good for growing embryos. If you think about it, your future child will spend the first 5 to 6 days of development in the laboratory. So the environment of the laboratory is really critical for normal development and for success rates. So our goal in creating our special laboratory was to give our patients the highest chance of getting pregnant with the first treatment that they undergo. Because nothing is more stressful than having to undergo multiple IVF cycles, more stressful and expensive. But this is just a picture of Portland. It's a beautiful city of about 2 million people. We're about 3 hours by car from Seattle and about an hour from San Francisco by plane. And this is our main headquarter building, which we opened about 3 years ago. Our clinic has 7 board-certified reproductive endocrinologists and now 8 embryologists who have many years of experience in culturing embryos in the laboratory. One of our specialties is genetics, and we have a 6-member genomics team, which consists of genetic counselors who will evaluate couples' risks for having children with genetic problems. And our genetic counselors also counsel our patients about the availability of genetic screening of embryos through biopsy. We have 25 staff members who are specifically devoted to the care of our surrogates, egg donors, and future parents. We have a large team, and this group of 25 staff are specifically devoted to the help of our intended fathers. We developed our mission statement 3 years ago, and I'd like to read it to you. It's to grow families globally by developing a talented team with effective processes that deliver compassionate, accessible, personalized, expert care for the best possible successes in reproductive and genomic medicine. And we really strongly believe that the care must be personalized because each one of you may have different needs and different desires in terms of creating your family. So we listen closely to what you have to tell us, and we create a treatment plan that suits your needs. We've helped men from over 30 countries have children through egg donation and surrogacy. I mentioned this morning we have an office in Tel Aviv, and we also have an office in Shanghai. So I have patients right now who live in Singapore, New Zealand, Australia, China, Korea, US, Canada, many countries in Europe, and we have a very large presence as well in Israel. We do participate in Men Having Babies GPAP program. Right now we're offering unlimited stage 1 awards. I think one of the important considerations when you're selecting a clinic is one that has extensive experience in egg donation surrogacy, because there are a lot of variables to the process. And our clinic in particular has been helping men for many years through this treatment. And we've kind of learned along the way what the best team is to provide care and what questions our future patients may have regarding how to arrange their care at our center. Portland's a great place to come for a short visit. You only need to actually come to provide a sperm sample that will freeze, so you don't have to spend an extended period of time in Portland. I know just from talking to many of the men today who've been to Portland, they told me how much they enjoyed coming to our city because it's a really beautiful place, very friendly city with great food and wine and beer, and we're very close to beautiful areas that are quite pristine, including the Cascade Mountain Range and the Pacific Coast. Our clinic is one of the largest clinics here in terms of the number of donor egg surrogacy cycles that we perform. We have very strong relationships with surrogacy agencies in the US and in Canada. So you can find the surrogate that you desire through the agency that you want to use, and that surrogate can come to our clinic for care. Many of our intended parents will pick a surrogate who lives in Oregon or Washington because these states have many healthy young women who are willing to be surrogates, and the laws and statutes in Washington and Oregon now are excellent for surrogacy. Washington actually just changed their law, so surrogacy is legal as compensated surrogacy is legal as of January 1st. Another interesting fact is that Oregon has the lowest rate of preterm labor of all of the states in the US as determined by the CDC. And I think that's a sign that women in Oregon are quite healthy and that they receive very good medical care during their pregnancies and at the time of delivery. Another potential advantage of having a surrogate in Oregon is that the fees are somewhat less expensive than some other states like in California. But as I mentioned, we're very glad to work with a surrogate from any state or province where surrogacy is legal. And Portland is a very easy city to reach by airplane, so we have surrogates that come from all across the country as well as from Canada. Our goal, though, as I mentioned earlier, is for you to achieve a pregnancy with the first treatment that you do, because it does lead to lower costs and it also leads to much lower stress levels. We have our own egg donor program. Most of the men that we help will select an egg donor through our clinic, although it's not a requirement. Over the course of a year, we treat approximately 150 women who are donors exclusively at our program. All of the donors are fully screened before they're made available for selection, so that you'd find information about them on our database, such as being able to see their picture, learning about their physical features, the outcome of past donations, what their compensation is, and whether or not they would need to travel from their home city to Portland for their egg collection. Oregon is a relatively large state, and some of our egg donors are in Southern Oregon, where if you were to select a donor from Southern Oregon, there would be extra cost because she'd have to come to our clinic to donate. One of the important aspects of screening egg donors is to determine if there's any family diseases. And each one of our egg donors is interviewed by one of our genetic counselors to try to get the most extensive information regarding the family medical history. And that's very important for you because the donor's family medical history will be the family history of your future child. Our clinic does not charge any agency fee for our donors, and many of the donors are local to the Portland area, so the cost is relatively low. Couples who search outside of our donor pool, maybe people who are looking for donors of a unique ethnicity that we don't have. For example, we have a limited number of Asian women who are donors, although we do have some. The donor can come from anywhere in the US or Canada. We've actually worked with egg donors that intended parents have found in their home country. So for example, recently I've treated egg donors in Taiwan, who come from Taiwan, from Malaysia, and from Europe. Our genomics program is very strong. We have 5 genetic counselors and the director of our laboratory, Allison Coates. And the genetic counselors will meet with you and review your family's medical history, and also they will look at your medical background in comparison to the potential donor's medical background to make sure that you have a good match. so they'll create a family tree that you can have for your future. They also help in counseling patients about the availability of genetic testing of embryos, biopsying of embryos, and what we learn through that process. There are different types of genetic tests that can be performed. We can do genetic tests on your blood to see if you're a carrier for a genetic disease. That's part of a family history evaluation. So that would look for conditions where if you and the egg donor were carriers for the same disease, your child could have that disease. For example, if you were a carrier for cystic fibrosis and your egg donor were also a carrier for cystic fibrosis, 25% of the children would have the disease. So we screen you ahead of time to make sure you pick the right egg donor who may not carry the same mutation that you have. So this is looking for recessive, autosomal recessive genetic diseases. A more common type of testing, though, would be testing directly of the embryo, where we can remove some cells from the embryo and analyze the cells for the number of chromosomes that are present. And this kind of testing is called, it's now called PGTA. The former terms were PGS and CCS, where we're removing some cells from the embryo and counting the number of chromosomes. Each cell should have 46 chromosomes, but if the embryo has 45 chromosomes or 47 chromosomes, like an embryo with Down syndrome might, then we know not to use that embryo. And that's very useful information in terms of identifying the embryos that can lead to normal children. So approximately 90% of single men and male couples who are going through egg donation treatments at our clinic will have their embryos biopsied for this screening process. And this is just a picture showing how the biopsy is performed. We wait until the embryo starts to hatch out of its shell, and the first cells that protrude from the hatching embryo are placental cells. So we can use a suction cannula and remove about 5 to 8 cells, and then use a laser beam to cut across the cells so that this cluster of cells can be sent to the genetics lab for analysis. And then we'll freeze the embryo that's been biopsied and use the frozen embryo at a later time. One of the important considerations is that even with donor egg cycles, where the egg donor is in her 20s, about 32 to 39% of the embryos that are biopsied are chromosomally abnormal. So having this extra information helps us know that we're picking the very best embryo possible. The technique that's used to do the analysis is called next generation sequencing. We feel that it's quite beneficial because it does, at least in our program, it's reduced the number of negative cycles and pregnancy loss rates, and it does evaluate for potential abnormalities that can grow into a fetus with an abnormality like Down syndrome. And unfortunately, in the past, I can think of at least one couple that we helped a few years ago where they conceived twins through a donor egg cycle, and one of the fetuses was affected with Down syndrome. So doing testing of the embryo before it's placed into the uterus will help for this process. Some couples choose to have their embryos biopsied because they're interested in knowing the sex of the embryos. That's also identified through the chromosome analysis. And we do allow selection of the sex if it's something that you desire, although we can't guarantee that you would have embryos of both sexes. The average number of genetically normal embryos that we have from one treatment cycle is 7 in our program. That's what's starting out with an average number of mature eggs of 22 from the donor. So you have to remember that some eggs will not fertilize, some embryos will stop growing, and some embryos will be chromosomally abnormal. So by starting out with a large number of eggs, we should have enough embryos, hopefully for at least 2 pregnancies. And quite often in cases where we're helping 2 men, both men will provide semen samples to fertilize the eggs so that each man could have embryos that are genetically tied to him. The potential risks for biopsying embryos would be possibly damaging the embryo. Our embryologists looked at the outcomes of almost 15,000 embryo biopsies that were performed through our clinic, And what our lab director calculated was that only a very, very small fraction, about 4 embryos out of the 14,000 embryos or more that were biopsied, appeared to have been damaged through the biopsy procedure. This is something that our embryologists do very regularly, and they have very good skills at the biopsy and at freezing embryos. This is data looking at our live birth rates at Oregon Reproductive Medicine through donor egg gestational carrier cycles over the past 4 years, where if we transfer 1 embryo, the live birth rate has been 66%. If we transfer 2 embryos, the live birth rate has been 87%. One important consideration with transferring 2 embryos is that there's a very high twin rate. And it's also important to consider that there's a chance that an embryo can split into 2. So there have been cases where we've transferred 2 embryos and the surrogate has conceived triplets. In fact, one of my patients actually had triplets about a couple, actually it was a male couple from China, had triplets about 6 months ago. And fortunately, the surrogate did really well. The babies were born at 35 weeks and they were extremely healthy. But it was a very high-risk pregnancy. Even twins is a higher risk pregnancy than a single fetus pregnancy. So for those who are looking for the lowest risk pregnancy possible, we certainly recommend just transferring 1 embryo at a time. This is our team. We actually perform more donor egg surrogacy IVF cycles than other clinics. And that may not necessarily be readily apparent considering that we're in Portland, Oregon, but we help people from throughout North America as well as from many different countries. You can access information regarding pregnancy rates through 2 sources, the CDC and SART. SART is our professional society, the Society for Assisted Reproductive Technology. And there are ways of actually looking specifically at donor egg surrogacy cycle outcomes with this SART website. So if you want to be a wise consumer, you can access this information and look and compare the live birth rates at different clinics that you might be considering. It's a little bit complicated, not too complicated, to use the filtering system through this SART website. So if you're interested in learning how to do that, please check with us. We can email you information on how to look at the SART website to find the information that you desire. But our team is very devoted to our LGBT patients, and you would find a very warm welcome if you choose to work at our center. Thank you very much for coming to my breakout session.